Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today, we're discussing a topic that has recently captured the attention of public health officials worldwide: Legionnaire's disease. This severe form of pneumonia, caused by the Legionella bacteria, has led to outbreaks in New Hampshire and Poland, raising critical concerns.
Legionnaire's disease isn't just your typical pneumonia. It's a serious infection that can lead to life-threatening complications, especially among the elderly and those with pre-existing health conditions. The bacteria responsible, Legionella, is commonly found in water systems like cooling towers, hot tubs, and plumbing systems.
Exactly, Alex. And it's these water systems that can become breeding grounds for Legionella if not properly maintained. The recent outbreak in New Hampshire, for instance, was traced back to a contaminated cooling tower at the Riverwalk Resort in Lincoln. 5 individuals were diagnosed with Legionnaire's disease, prompting immediate action from health officials.
The symptoms to watch out for are fever, cough, and shortness of breath. Symptoms that might seem like a typical respiratory infection, but can escalate quickly. In New Hampshire, the Department of Health and Human Services advised residents and visitors to monitor for these symptoms, particularly if they had been near the cooling tower.
The state epidemiologist, Dr. Benjamin Chan, emphasized the importance of early detection, especially for those at higher risk, including older adults, smokers, and people with chronic health conditions. The quicker the diagnosis, the better the chances of managing the infection before it leads to severe complications.
The cooling tower at Riverwalk Resort has since been sanitized, but the DHHS warned that the area still poses potential risks, particularly for people living within a half-mile radius. This outbreak underscores the importance of regular maintenance and monitoring of water systems, especially in public spaces.
And the New Hampshire case isn't isolated. Over in Rzeszów, Poland, an even more alarming outbreak occurred during August and September 2023. There were 165 reported cases of Legionnaire's disease, with a case fatality rate of 15%. That's a significant number, and it highlights just how dangerous this infection can be.
In Rzeszów, environmental testing revealed elevated levels of Legionella in water samples taken from both residential and public buildings. This outbreak really drives home the importance of routine testing and disinfection of water supply systems. It's a public health priority that cannot be overlooked.
And what makes this even more concerning is that, despite the severity of the outbreak, there's a lack of strict legal regulations in some areas regarding the periodic disinfection of water systems. This puts even more pressure on property owners and public health officials to collaborate and implement preventive measures.
To address these challenges, advancements in diagnostic methods have become crucial. A study conducted in an Italian hospital from 2016 to 2023 showed how improvements in diagnostic algorithms, including molecular detection methods like the biofire film array, have enhanced our ability to detect Legionella infections swiftly and accurately.
These advancements are vital because traditional diagnostic methods, like urinary antigen tests, while useful, don't always catch every case. The introduction of molecular detection techniques allows for a more comprehensive approach, helping to identify cases that might have otherwise gone undetected.
And it's not just about the lungs. Legionnaire's disease can also have serious effects on other parts of the body, particularly the cardiovascular system. There's a compelling case study involving a 51-year-old woman with a history of chronic health issues. She developed Legionnaire's disease, and it led to severe cardiac complications, including a condition similar to reverse Takotsubo syndrome.
This case is a stark reminder of how Legionnaire's disease can go beyond respiratory symptoms, potentially leading to life-threatening conditions like myocarditis or stress-induced cardiomyopathy, especially in those with compromised immune systems or chronic health issues. The patient in this case was treated with a combination of antibiotics, immunoglobulins, and cardiac support medications, which thankfully led to her recovery.
These complexities highlight the need for a comprehensive treatment approach, addressing not only the infection itself, but also the secondary complications that can arise. And while conventional medical treatments are essential, there's also room for complementary therapies using herbal remedies.
That's right, Alex. Let's talk about some herbs from the Lost Book of Herbal Remedies that could offer supportive care for individuals dealing with Legionnaire's disease. First on the list is Andrographis paniculata, or Andrographis. This herb is known for its immunomodulatory, antibacterial, and antiviral properties, making it a potential ally in boosting the immune system to fight off Legionella.
Next up is Echinacea purpurea, commonly known as echinacea. It's well regarded for its ability to stimulate the immune system and reduce inflammation, which can be incredibly beneficial in managing the body's response to infection.
Sambucus nigra, or elderberry, is another herb worth considering. It's famous for its antiviral properties and its ability to support the immune system. This makes it particularly useful if there's a viral co-infection that could complicate Legionnaire's disease.
Pelargonium sidoides, or Yumkaloabo, is an herb with antibacterial and mucolytic properties. It helps with the clearance of mucus, making it a good option for respiratory infections like pneumonia, which is a primary concern with Legionnaire's disease.
Licorice root, or Glycyrrhiza glabra, is another powerful herb. It's known for supporting the immune system, relieving inflammation, and offering protective benefits for the cardiovascular system, key areas to focus on when dealing with the complications of Legionnaire's disease.
And let's not forget Crataegus spp, commonly known as hawthorn. This herb is celebrated for its cardioprotective effects, making it particularly valuable for individuals at risk of heart complications due to Legionnaire's disease.
It's important to remember that while these herbal remedies can offer significant support, they should be used to complement, not replace, conventional medical treatments. And as always, it's crucial to consult with a healthcare professional before starting any new herbal regimen, especially if other health conditions or medications are involved.
The recent outbreaks in New Hampshire and highlight the ongoing threat posed by Legionnaire's disease. With the increasing detection of cases and advancements in diagnostic methodologies, it's essential for communities and health officials to remain vigilant. Implementing preventive measures, enhancing public awareness, and utilizing advanced testing techniques are key to controlling the spread of this serious bacterial infection.
Absolutely, Alex. So to wrap up, the recent outbreaks of Legionnaire's disease serve as a reminder of the importance of public health initiatives, regular monitoring of water systems, and early detection. With the right combination of preventive measures and awareness, we can better protect ourselves and our communities from this serious infection.
Thanks for tuning in to this episode of the Lost Book of Herbal Remedies. We hope you found this discussion on Legionnaire's disease both informative and helpful. Stay safe, and we'll see you next time.
Until next time, take care and stay well.